Welcome back. We'll continue live summer school week now with an important lesson to help us stay safe this summer. Here with when and why to go to the ER is emergency medicine physician Dr. Sampson Davis. Hey, Doc.
Hey.
Welcome back.
Thank you. Great to be back.
All right, let's get started. During the summer, what are some of the most common emergency injuries that you see?
Yeah, so we have a little bit of a list, but we think summer sports-related activities, sprains, strains, and broken bones. Us senior people, we get out there, we exercise, we play volleyball, a little foosball, racquetball, and then we twist things and we sprain. Exactly. Then you think about the broken bones. So that's the skateboarding, things of that nature, rollerblading, bikes.
Yep.
So you want to make sure you have your helmet, your wrist guards, your elbow guards, and your knee guards. Oof. So those are important things. The other sort of injuries that we worry about during the summer are things like foodborne illnesses, so grilling.
Okay.
Grilling. I know you're probably a grill master.
I'm a big griller, yeah.
Yes.
I always like to make sure it's cooked, but also you're out in the sun.
Leave it.
So you worry about the potato salad being left out. So you want to keep it refrigerated as long as possible. And then when you put it out, you can put some ice underneath it, keep it away from the sun and try to keep it in a shaded area. Undercooked poultry and seafood are master disasters. You want to make sure that everything is cooked to taste, but also that it's cooked well enough that it won't cause any illnesses. So important.
Ooh.
Yeah.
Some of us have learned that the hard way. We know how that goes.
All right, what about at home? First aid kits. We all kind of have them. What are some of the things we massively should have?
Yeah, so first aid kits, we all have things that are particular to us, your seasonal allergies, your thermometer, but during the summer times, you want to make sure you have your ice pack.
Sure.
So when you do fall and twist or hurt yourself, you can ice it, very important. Band-aids for the little ones, because they always trip and fall, chasing after each other.
I'm in it right now. I have 3 little ones, and I'm like, I'm taking all this in. I'm like,
You're a Band-aid expert.
All these every week, sometimes a few times a week. Yes.
Yes, a Band-aid expert. And then the bandages. This is the compression. So anytime you do have a swelling or a joint injury, you can wrap it to make sure that it's well protected, so that it decreases the swelling and, more importantly, the pain.
Okay.
How do you know, this is something I'm always curious about with 3 kids, how do you know if you should go to the ER versus urgent care?
Very good question. So when it comes to urgent care, my fair rule of thumb, if you can walk or drive, then you're probably safe. It's not gospel, but it's my fair rule of thumb. So sniffles, congestion, ear pain, a little small rash, cough, even some minor scrapes and cuts, you still can go to the urgent care because they can suture and bandage it up for you. Some other injuries, if you can call ahead, very important, call your local urgent care ahead. Do you have x-ray machines? If you do have an x-ray machine, you can go for those situations to be seen.
Right, that's true, because I want to make sure you've got to be able to check out and see if you've actually hurt yourself, broken bones. I mean, we are there all the time.
All right, so I've heard that you have 2 scenarios, and you're going to quiz us on whether or not we should, as parents, which we would do. Go to the ER or urgent care.
All right, drum roll.
Okay.
All right, so you have your child, say your child's playing on the trampoline. I know my kids love trampolines. They're jumping. They take a fall, unfortunately, they hit their head. Right? They start to vomit. They pass out for just a second. 20 minutes pass, they're bouncing around again as if nothing happened. You know, children are very resilient. So do you go to the ER or do you go to the urgent care?
I know what I'm doing.
I'm ER because of the vomiting. That to me freaks me out.
Head injuries freak me out.
Jenna, you're right on. Yep, the vomiting and the loss of consciousness. So concussions are very common with minor head injuries, but what you worry about is internal brain bleeding. So some of the signs that clues us in is vomiting or loss of consciousness. Again, it's not an absolute, but it clues us in that this child may need to have a CAT scan of their brain.
And better be safe than the alternative.
Yes.
All right, give us the second scenario.
So the second situation is you're grilling, Mark. You're on the grill, and you're making your favorite, your favorite items there.
Okay.
And you drop your fork. And people are watching, so you say, I can't pick the fork off the ground. So you use your hands real quick to grab the items off the grill. You don't think anything about it. The adrenaline is flowing, but you look down and you have all this blister formation on both sides of your fingers. Like, say 3 fingers are involved, all around in a circular pattern.
Okay.
What do you think?
I'm going to the ER.
Yeah.
So the reason why, and you're correct, you're both correct, ding, ding, ding. The reason why you go to the ER is because anytime there's circumferential burn with the hands, meaning the burn goes all
the way
around the
around.
finger, you worry about the ability to have fine motor movement, dexterity being involved and being damaged. So you want to make sure that you don't have any deep tendon injury there, because once those burns set in that way, you can lose mobility in your hands.
Okay.
So it's important. But simple burns, not to involve, you can always go to the urgent care for that.
So good. Yeah,
important.
really important. More on when and why to go to the ER with Dr. Sampson Davis when we come back. Stick around.
Hey, we're Dr. Davis, and we're discussing when and why to go to the ER. All right, so when would you suggest urgent care over the ER?
So the urgent care are the small items, the cuts, the abrasions that we worry about, sore throats, ear pain, but the ER, once you go to the ER, is really important to understand if you have a severe headache, confusion, chest pain, shortness of breath, if you have limb weakness, signs of a stroke, visual changes, things of that nature you worry about, and you don't want to drive yourself. You want to make sure you call EMS. If there's a drown, especially during the summer months now, drownings are unfortunately very
scares me.
common.
Yeah, really.
So important that you keep your eye on your child or those who don't know how to swim, and make sure they have life vests. If you're in a public area, make sure that you swim by the lifeguard. And if you're home, fence around the pool.
Yeah, really important.
And that alarm, so important, because it's a split second it can happen.
Just be, oh, what should you be bringing with you to the ER?
So you want to bring yourself, and
The injury.
your ID is important. List of your medications. You want to bring an advocate, because if you have severe abdominal pain,
You cannot talk
You
in.
just can't talk, and you
Right.
can't really process what to do after the visit if you are allowed to, if you're able to go home. You want to make sure that you also, besides bringing the advocate, that if you are discharged, that you follow up with your family physician. Now, keep in mind, sometimes you come to the ER, you're like, well, I was here before this person. But we triage people. We see people in terms of their severity, not their arrival time. So if someone's there with chest pain, shortness of breath, they're going to trump or go before someone's there that's there with leg pain per se. Also make sure to understand that we don't have orthopedists and dermatologists sitting in the ER. So if you come to the ER and you have to follow up with a specialist, you have to do that after your discharge, and make sure that you read your discharge papers. Sometimes my patients come back and say, here's my discharge papers. I say, okay, what did they say? I don't know, right?
That's what we said. I said, we know you're getting hit up by your family and your friends all the time. So
Yes.
what's this do? What do I do here?
So make sure you do that, read your discharge papers. And a lot of ERs have patient portals now. So you could go in and see your labs and see your results and track your results and see accordingly what was done and share with your family physician.
Great information. All right. For more info like this, head to our website.